Heart murmurs are sounds that we hear with our stethoscope that suggest turbulence in the heart valves. All blood in the heart, there's 4 chambers and 4 valves, and all the blood is supposed to go one way. There's supposed to be no regurgitation, which means leaking backwards, and there's supposed to be no stenosis or restriction of valve motion. And heart murmurs usually represent either regurgitation or leakage, or restriction or stenosis. And those are important things to identify. Importantly, there are innocent murmurs that can occur with simple things like fever and thyroid disease. But most of the time when you hear a murmur, it needs to be evaluated by a cardiologist and it needs to be quantified for follow-up.